Hello, this is Kelly Curley, and we're going to go over medication administration, how to use an inhaler, and teach our clients how to use an inhaler. So first of all, before we get started, why would someone need to take medication through an inhaler or a nebulizer treatment type method? Well, clients that we typically see that need an inhaler include clients that maybe have asthma, COPD, chronic bronchitis. It could be a client that is suffering from pneumonia, clients that have other oxygenation problems, pulmonary fibrosis. They may need an inhaler as well. So what types of priority assessment do we want to do before the client uses their inhaler and then after the client uses the inhaler? What kind of priority assessments do you think would be appropriate for like a focused assessment? Well, we're going to want to take respiratory rate, oxygen saturation, and auscultating those lung fields. Those are going to be our three priority things. I'd like to start out with a video, so I'm going to try to switch over screen sharing. Okay, if any of you have watched Dr. House before, you know he's kind of got a little bit of an attitude. But here's a funny video about inhalers.
My asthma. They said they fixed it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. And try twice as hard to fix your inhaler.
All the time. Go through one a week.
Sure. Is it right?
Do I look like an idiot?
No. Let's show you how your inhaler works.
So as you can see, just a moment. Okay, so I think I'm back now. So as you can see, you may think a client knows how to use an inhaler properly. However, if they're not using it correctly, the medication is not going to work for them. So let's talk a little bit about the correct ways to use inhalers. So the first type of inhaler that you're going to see in this picture, it's in the top right-hand corner, is called a metered dose inhaler. This client also has a spacer that they're utilizing. We see spacers utilized quite a bit in children. However, with our recent COVID outbreak, pandemic, we have seen spacers being utilized in our adult population. The great thing about a spacer is it kind of harnesses all that medication in there. And if a client really has trouble utilizing their inhaler correctly, it helps them by having it concentrated right there to help them breathe that in again. So overall, with metered dose inhalers, you need to shake the inhaler for about 2 to 5 seconds prior to using it. You want to make sure that the client takes the mouthpiece off. And if the inhaler's not been used within the last 48 hours, they need to prime the inhaler, meaning they need to push down on it once to ensure that the next compression gets the correct dose of medication. So that's if they haven't used it in 48 hours. If the client's going to use a spacer, what they need to do is take the metered dose inhaler and it goes at the opposite end of the spacer mouthpiece. So mouthpiece is on one side, opposite end is when the inhaler goes in. They need to place the mouthpiece in their mouth with the teeth around the mouthpiece and seal it with their lips. They can breathe normal through the spacer. They're breathing in normal in and out through the spacer. They're going to depress the canister on the inhaler one time. They're going to inhale slowly through their mouth because they're breathing in through that mouthpiece, right? Inhale slowly through the mouth, hold their breath for 5 to 10 seconds, and then exhale through pursed lips. They're going to need to take the spacer out of their mouth to exhale. They can wait 1 minute and repeat if it's prescribed to do more than one puff. If they're really short of breath and they're having a hard time getting a good deep breath in, they may leave that spacer in their mouth and breathe in and out with that spacer for a second to ensure that they get all that medication in. Once they're through utilizing their inhaler, they'll put the mouthpiece back on, they'll clean it as directed, and depending on the type of inhaler, they may need to rinse their mouth out with water afterwards. So learned a little bit in oxygenation about certain types of medication that we want to make sure the client rinses their mouth out with. So you'll want to refer back to that in the oxygenation area. Some home considerations. Many times clients in the past would what they would call float their inhaler. They put their meter dose inhaler down in water to see, hey, if it floats, it's still got stuff in it. Or if it sinks, oh, it doesn't, it's empty. That is not a recommended standard care. Once you get water in there, water and air and places that are dark and damp, they grow things, right? Like mold and mildew. And that'd be really bad to have on your inhaler that you're going to breathe in. So we do not want our clients to float their inhaler in water. We do not want our clients to overuse their medication in their inhaler. If they overuse, if they use it too much, too many puffs, too frequently, they can actually get rebound inflammation. They can get bronchoconstriction, which would be bad because these clients already have trouble breathing, right? They can use a dose counter, which will tell them how many doses they have left in their inhaler. Make sure to allow any area that gets wet to be cleaned, that it needs to dry completely. We do not put spacers in a bag because if you're cleaning your spacer with water and then you put it in a plastic bag, microorganisms can grow. So it needs to be left out so it can air dry. If the client's not using a spacer, let's say they're just doing the meter dose inhaler, no spacer. These are the steps the client's going to take. They're going to take a deep breath in and exhale. Then they're going to place the inhaler mouthpiece directly in their mouth, securing it with their teeth and sealing around it with their lips. They're going to inhale slowly and deeply through their mouth as they depress the canister. Once they inhale all the way, they've depressed the canister, they're going to hold their breath for 5 to 10 seconds. Take the inhaler out of their mouth and exhale slowly through pursed lips. We want them to wait 1 minute and repeat the dose if 2 puffs are prescribed. So if it's just 1 puff, they're done. If it's 2 puffs, they need to wait a minute before they do their second puff. They need to put the mouthpiece back on, clean anything that they use as directed. And if they're using those certain types of medication, they would want to rinse their mouth with water and make sure that they spit out the water afterwards. The next type of inhaler I'm going to show you is called a dry powder inhaler. So a dry powder inhaler looks a little bit different. It's kind of like a disc, like a circular in nature. So you want to make sure that you take off the mouthpiece, or for these, you actually kind of flip it around. It turns in on itself. So you'll open it up by turning the circle on the inside to where the mouthpiece is showing. There may be a place to load the dose where you push this back. This one has a little lever up here on the top. So this right here is your mouthpiece. Here's your little lever that you would actually push down this way and it loads your dose for you. We want to tell our clients to make sure that they breathe out slowly without their mouth around the inhaler. So they need to exhale without this being in their mouth. Once they exhale, place the inhaler in their mouth, put their teeth around the mouthpiece, and then seal their lips around that mouthpiece as well. They need to get their teeth and their tongue out of the way in their mouth so that you don't want to block the mouthpiece with your teeth or your tongue. They need to breathe in through their mouth, strong, steady, and slowly for 2 to 3 seconds. Clients that have used a discus, a dry powder inhaler, it almost looks like they're sucking on a straw, but instead of their mouth being around a straw shape, it's around this mouthpiece. They really have to kind of breathe in and kind of suck in hard, kind of like a milkshake, in order to get that medication to go in. They're going to breathe in strong, steady, and slowly for 2 to 3 seconds. They're going to take the inhaler out of their mouth and hold their breath for 5 to 10 seconds, and then exhale through pursed lips. They can then return this to the storage position, so they flip it back around. If they need to rinse their mouth out with water and then spit the water out, that would be the time to do it after that. On your PowerPoint that's a blank copy, there is a link to Spiriva, which is one example of a dry powder inhaler and how to administer it. Nebulizer treatments. Most of our clients that are in the hospital are probably going to be switched over from some type of inhaler to a nebulizer treatment. Now, with COVID, they tend to stay more towards inhalers, but with everything else, they tend to go more towards nebulizer treatments. Clients can have nebulizer machines at home. So if they suffer from asthma or COPD, and they need to go home on some of these medications that help with oxygenation, there are portable nebulizer machines that they can utilize at home. Key things to remember is you need to get whatever equipment you need out, whether that's your neb mask and your wall flow meter for your medical air at the hospital, or whether that's the nebulizer portable machine at home and your mask with your connecting tubing. You want to make sure that the client knows how to open up the nebulizer cup and the medication, and you would place the pre-measured dose of medication in the bottom of the cup. You twist the top back on the cup. You would make sure that the little cup that holds the med in it is attached to the face mask or mouthpiece, and that the other end of it, the tubing end of it, is attached to the nebulizer machine or to medical air on the wall flow meter. You want to make sure that you're turning the nebulizer machine on. If it's a portable machine, there's just an on-off button. There's not, you don't have to turn it up to a certain number. If you're inpatient and in the hospital, the medical air is usually between 6 and 10 liters. It just depends on the type of mask and different types of nebulizer that they're using. So you want to follow respiratory therapy's lead on it, or what your order says. What should happen is there should be enough medical air movement to go through where that liquid medication is, and it's going to turn that liquid medication into an aerosolized medication. It's going to make it kind of fog and steam up. That's what we should see. You should see that aerosolized medication. You're going to make sure that you place the face mask on the client's face. Now, some of them do have mouthpieces instead of face masks. The client down here at the bottom is wearing a face mask. He just doesn't have the strap going around the back. The client above has a mouthpiece where it goes in the client's mouth. They can breathe in and out through that mouthpiece. Whichever way, we just want to make sure that when the aerosolized medication starts, we've got it on one way or the other. If they are using the mouthpiece, they need to secure it with their teeth and seal it with their lips. We want to tell our clients to inhale slowly and deeply through their mouth. We'll continue until all the medication is aerosolized and the cup is empty. So that's how you know you're done. The client may need to rinse or gargle and spit with water afterwards, depending on the type of medication. We want to clean the mask, mouthpiece, or cup as directed and allow it to completely dry. So these are the ones we typically kind of clean out and we leave them sitting out to dry, especially if they're at home and they're utilizing this over and over again. Last thing is client teaching. It's very important that the client knows why they need this medication. It's important if they know if it's a short-acting medicine or a daily longer-acting medication. So when you listen to the oxygenation information, there's some medications that they will start working very quickly. That's for clients that are experiencing trouble breathing right now. They can take that medicine and it's going to help fast. There's other medications that clients should take that are longer acting. They take it every day so that they don't have breathing problems, but they don't kick in for a long time. They're long acting. So they're not going to take it if they're having a problem right now. They really need to take that short acting one. It's important that your client knows which one's the short acting and which one's the long acting and when to take both of them. It's also important that your client knows not to overuse. If they continue to have problems with their breathing and they're feeling like they're needing to use it more than it's prescribed, then that's when they need to go to the doctor. Overusing it can actually make them bronchoconstrict more. It can cause more inflammation, more constriction of those bronchioles, and can actually make their breathing worse. They need to know how it works. Is this one that helps with the inflammation? Is this one that helps to open my airways? What happens with this? They also need to know any side effects. Some of these have side effects that kind of make you jittery or make it where you might have trouble sleeping. And if that's the case, they probably wouldn't want to take it right before they go to bed, right? So they need to know any side effects or any nursing implications of the med. And nursing implications could mean that this is the type of oxygen medication that they need to rinse their mouth out afterwards so they don't get oral candiditis or thrush. If they are taking more than one type of inhaler at a time, so let's say your client has 2 inhalers, they're supposed to take them both in the morning. They need to take the one that is a bronchodilator first. So anything that's going to bronchodilate. So think about it, broncho, left and right main stem bronchus, bronchioles, it's going to dilate them. It's going to make them bigger. If we make them bigger, more air gets in. If more air can get in, then more medication can get in. So give the bronchodilator first, because it's going to open up those airways. It's going to dilate the bronchioles. Then if you have another medication, hopefully that medicine's going to get down in there better because everything's going to be nice and opened up, right? All right, shake, shake, shake. They need to make sure they're shaking vigorously 5 to 6 times before using an MDI. So you want to make sure that they're shaking it. That's around 2 to 5 seconds, but they need to shake it really hard 5 or 6 times and make sure that they take their cap off. We want to make sure that we're telling them to exhale outside the inhaler, to put their teeth and their lips around the mouthpiece so their teeth are out of the way, and to inhale slowly and deeply while pushing down or administering the medication. Another key point is not just that inhale, but they want to hold their breath. If they can't hold for 10 seconds, hold it for 8 seconds. If that's all you got, that's great. By holding that medicine in there, you're allowing the medicine to have more time up against the inside of those respiratory tract airways. The more time it has, the more time it has to work, the more time it has to cross over that barrier. So we want them to hold their breath, right? That way more of that medicine can get in there, float around, really work. Then they want to take the inhaler out of their mouth and exhale outside of with the inhaler out of their mouth using pursed lips. And pursed lips is kind of like you're going to go whistle. If they need to take multiple doses of the same medication, let's say they're taking a bronchodilator and they need to take 2 puffs of it. They need to wait at least 1 minute between puffs, okay? Some books say 1 to 2 minutes, at least 1 minute between the first puff and the second puff of the same medication. If they're taking 2 medications, they need to wait at least 1 to 5 minutes between medications. Some of your information varies on if it says 1 minute or 5 minutes. The key thing is it's at least 1 minute wait and then use that other medication. How this looks in the hospital. Let's say they've got 2 different medications. First one's a bronchodilator. They're going to do 1 puff of it. Then they're going to do another medication. Give them the bronchodilator first. Let them do that puff. And then while you're waiting a few minutes, you can be doing other stuff, whether that's giving them some PO medications, whether that is giving them their IV, hanging up their IV secondary tubing, or giving them an IV push. Then follow up at the end with the second inhaler medication. Gives that first one time to start working. Then you hit it with the second one 1 to 5 minutes later. Make sure the clients know what they need to do with cleaning any equipment when they get home. And the key thing is making sure that all of this equipment gets dried, that it has time to air dry, that we're not just shoving it down in a bag wet and hoping that things don't grow. Thank you for your time. And if you have any questions, please feel free to reach out to me in class.